So a familiar slide to everyone at this point. This is our needs assessment process. We started by getting ourselves organized for success and engaging our community partners and completing a visioning process. We are now in the process of gathering assessment information and interpreting those data, making sense of them. As you remember, those steps involve 3 separate assessments, and you've gotten started with 2 of those assessments, and we'll talk about the 3rd today. When we're done with the assessment process, this is kind of where it gets exciting. The next process for us will be identifying strategic issues, looking across all those findings from all those assessments, figuring out those items, those ideas, those findings that really stand out to you and seem particularly important for your community, and using those to set some priorities around which you'll develop goals and objectives, and then strategies and action plans. Within steps 4 and 5, we have 3 assessments. We've talked about the community themes and strengths assessment, and we've heard great stories about the work you have underway under those under that first assessment. You've been receiving data over the past month or so on the maternal and child health status assessment, and we talked about how to work with those data back on March 9th. And today we're going to be talking about the maternal and child health system assessment, which I'm really excited to be introducing to you this afternoon. As a reminder, we're couching all of this work within the life course framework. Keep in mind that health status at every phase of life is impacted by exposures and experiences in health in early stages of life, and even intergenerationally. So that's why we want to keep in mind throughout this process that it's important to make sure we're looking at health status and as well as experiences and exposures and our system's capacity to support health at each stage of the life course. Another familiar slide to you at this point. This is the way that we're thinking about all of the data that we're looking at. This pyramid mirrors the health impact pyramid that you're familiar with that CDC uses, but kind of has more of a data focus around it. So it really communicates the idea that health outcomes and health behaviors are affected by, influenced by both community health and the direct enabling services that a community has available to its citizens, its people. And community factors and the service system are influenced by broader systemic factors that influence what a community has available and influence health behaviors and health outcomes. And this public health systems piece of the pyramid is really going to be our focus today. As you've gone through the assessment process so far, you've probably learned and seen quite a bit about health outcomes and health behaviors, as well as the social determinants of health within your communities. However, we've really done much less to explore the system factors that underlie those outcomes that you're seeing and those behaviors that you're seeing, as well, and the social determinants that you're seeing within your communities. Kind of talk about a way to explore the system factors today. Before we jump in, I want to take a minute to pause and unmute all of our lines. Ask you a couple of questions. We'd love to hear about your themes and strengths assessment, how those activities are going, how your health status assessment is going, and to pause and answer any questions that you might have about the process or about the tools, about the data, really anything that's come up for so far. If you have a question, probably someone else has that exact same question. So we have lines unmuted, and so let us know how things are going or ask any questions that you have. Okay, no brave souls willing to jump in and share their stories, it sounds like this morning. We'll pause, of course, for questions later on about your are to date and about this next step in the process. We had a couple more folks join, so I'll do another reminder to please mute your phones and more importantly, remember to not put your phones on hold during the call. Let's dive into talking about the maternal child health system assessment. The first thing that we want to share, and I think that you've heard this message already, but this assessment, HHS has decided to make this assessment optional for everyone, totally recognizing that this is a heavy lift, this is a big process. You're all working really hard and doing some awesome work learning about your communities and exploring your data, gathering data, and we're really excited to see all of that progress that you're making, but don't want this to be completely and totally overwhelming. So the assessment is completely optional. It's not one that you have to complete. However, we're strongly encouraging you to at least consider completing the assessment or consider completing part of the assessment. As you jump into it, you'll see that the assessment is broken down around the essential services, the MPH essential services, and there's 10 essential services. So you could pick one of those, you could pick two of those, you could pick a couple areas where you feel like haven't had a lot of good conversation about how to do our policy work or what we're doing around workforce development. And so this is an opportunity to sit down and have a conversation about that. So we'd really encourage you to pick up a couple of the essential services, at least that speak to you, that you feel like you could have a good conversation about, and at least explore the assessment from that vantage point. We definitely understand that while we think it's important to explore your systems and understand your capacity around the essential services, that everyone might not have the time and space and resources to dive into this piece of it. So again, totally optional. Please take a look at it, consider completing it, or consider completing a part of it. But all of those options are on the table and available to you.
To just add, even though it's optional for this year with the funding that you received, and you know, for some reason you aren't able to do part of it, please remember that you can consider assessment is ongoing. So maybe this is an activity that you want to do next year to really understand your MCH population more. So just because we don't have the time and the energy this year doesn't mean that we wouldn't have it soon in the future. So I just lift that up for your consideration as well.
Such an important point, Trudy, to make, that assessment is at its best an ongoing process, and not every assessment activity has to be completed within a fiscal year, and it can be smart and strategic to plan different assessment activities over the course of several years. So this assessment looks specifically at your maternal child health system's capacity to deliver essential services. And the assessment will help answer a couple questions. What are the activities, competencies, and capabilities of the maternal child health system? And how are essential maternal child health services being provided to the community? So I'm going to be using this term, maternal child health system, frequently throughout today. So I want to take a minute to pause and tell you what I mean when I say those words. When I'm saying the maternal child health system, I'm referring to the health department and all of the other sectors, agencies, partners you have within your community that also play a role in producing health for women, infants, children, middle childhood, adolescents, the whole spectrum. So, you know, obvious partners are your hospitals, your schools, your pediatricians, your public safety system, your EMS system, all of those agencies, sectors, partners that play a role in producing health for folks in your community across the life course are part of your maternal and child health system. So those are the partners that you identified and engaged to be a part of your body that is completing this assessment. So those are the folks that you'll go to complete this assessment, because those are the folks that can speak to the capacity of the system as a whole. So as we talk about these capabilities and areas of capacity, we're not only talking about what the health department does, but talking about what the system does in general. So a really good example of this is around policy. From health departments, it's really hard for them to be directly involved in advocacy around policy. However, they can play a role in providing information that's supportive to an advocacy group within their community that can take those more direct actions around promoting or putting forth a policy agenda. So it's again, not only the activities of the health department, but the activities of your partners in producing health for women and children and adolescents in your community. Assessment is designed to be completed through a facilitated discussion. So it's really different than the other assessment activities where you're looking at numbers and data, or where you're completing a data collection process like a focus group or interview. It's an assessment where the activity is really a discussion, exploring each of the essential services. Around each of the essential services, you'll be looking at your system's strengths and your system's opportunities for improvement. If you have a large group that you've pulled together to support the assessment, it could be just specific sub-piece of that group that come together around particular services. Oftentimes around assessment, for example, around the first essential service, there'll be a group of folks that is really more familiar with surveillance activities, assessment activities within the community that can come together and have that discussion. It doesn't have to be the entire group that comes together for that piece of it. For the ninth essential service, there will be a subgroup that can form that can really speak to capacity around evaluation. So it doesn't have to be everyone participating in every component of the conversation. You can be really strategic and planful about who to include for each of the essential services to kind of maximize the use of that group and make sure that it's not an overly time-consuming process for any particular member of the group. So I've been saying the essential services, and so we should probably define and name what they are. So the MPHI essential services, if you're familiar with the 10 essential public health services, the MPHI essential services are very, very similar to those, but not exactly the same. They overlap quite substantially. So the first essential service is assess and monitor MPHI health status to identify and address problems. So under this service would fit activities like this. The assessment that you're completing would fit under that essential service. A lot of your surveillance work might fit under that service as well, or the work that you do to present and prepare data for community members or community partners would fit under that essential service. The second essential service is to diagnose and investigate health problems and health hazards affecting women, children, and youth. So for maternal and child health, this might include the activities that fall around lead exposure or other environmental health hazards that exist in your community. It could also include investigation around communicable disease that is emerging in your community. The essential service, inform and educate the public and families about MCH issues. And so this is where a lot of the health education activities might fit for your community. And this isn't only direct health education with clients, it could be health education around immunization information that you share with schools, or working with schools on an immunization education program for parents. It could be a variety of things that are intended to bring awareness to the public around MCH issues and children and women's health. The service is mobilize community partnerships between policymakers, healthcare providers, families, the general public, and others to identify and solve MCH problems. So this is part of what you're doing as well with this assessment activity, where you're putting together your partners and you're talking about, or you will be talking about in the next stages of this process, what are our key health issues that we want to tackle and how are we going to do that collaboratively? Many of you probably have collective impact collaboratives or other groups where partner around children's issues or maternal and infant health issues are brought together to think about how are we going to solve problems together as a community. This service is provide leadership for policy setting, planning, and policy development to support community efforts to assure the health of women, children, youth, and their families. So this is where all the great policy work that you do as a community fits in. And this can be policy at each level. This might be organizational policy, so this might be around together policies that move hospitals towards being baby-friendly. This could be policies around food that's offered through concessions at schools, all kinds of policies of that nature. It could be local policies. It could be policy around your plan. No, thinking of the plan that structured how a community is built out. And the word is just not coming to me. But those local policies that are locally developed and shared across the community that shape what your community looks like. They can also be state-level policies or federal policies, sort of the ones that immediately come to mind. But it can be policy at all of those levels. It's going to keep me. I'm going to think of what that word is. Okay, Essential Service 6 is promote and enforce legal requirements that protect the health and safety of women, children, and youth and ensure public accountability for their well-being. So this is all the enforcement activities that happen in your community through a variety of organizations responsible for making sure that the laws that are intended to keep people safe and healthy are followed. Link women, children, and youth to health and other community and family services and assure access to comprehensive quality systems of care. So this is the essential service that's really around making sure that people have access to health care. And so this could be through directly providing services, or this could be around linkage and support for navigating the healthcare system. Oh, thank you so much. Ann Barna, thank you so much. I'm thinking of the master plan. That's exactly right. I appreciate that. Now I won't have to ponder over it. Thank you. Service 8, assure the capacity and competency of the public health and personal health workforce to effectively and efficiently address maternal child health needs. This is the workforce development essential service. So this is really around how do people learn about getting involved in and having a career in maternal child health, and how do you support people who have a career in maternal child health and continually developing and becoming more and more prepared for that role and for the changes within the field. So it's workforce development. Essential Service 9 is evaluate the effectiveness, accessibility, and quality of personal health and population-based MCH services. So this is where evaluation as well as performance management and quality improvement activities fall. Essential Service 10, support research and demonstrations to gain new insights into and innovative solutions to MCH-related problems. And this is really about engaging in research from multiple perspectives. So you could, you might have sites where research is happening within your community around maternal child health, but it could also be, and often is, more focused on how you use the results of research to make sure that your programs and services and broader things, policy system environments within your community are aligning as well as they can with best practice and the evidence that's coming out through the research. So assessment itself is organized around those 10 essential services. So for each of those services, there's a series of questions that guide you to have a discussion around where is our system and our capacity to deliver this service. So after the assessment, you'll be able to answer a couple questions, or be asked to answer a couple questions in the body of the tool if you choose to complete it. You'll talk about the partners that you had at the table, how you facilitated an open discussion of each service with your partners, and what the strengths and limitations were of the process, just to help us have a picture of what you did and how you did it. So the MCH system assessment was created based on a lot of existing work and thinking. We definitely didn't try to reinvent the wheel. We tried to kind of take what was out there and streamline it and make it a little more MCH focused. But if you have exposure to any of these things up on this slide, it'll be very familiar to you. So we use the National Public Health Performance Standards Program, which came out from the CDC quite a few years ago, and it was sort of a foundational piece that led to the development of the Public Health Accreditation Board standards and measures. It was sort of the jumping off point for that work. And the MPHI is part of MAP. It's the fourth assessment for MAP. So if you've completed MAP, you may have completed this. Your health department may have completed this with your partners. MPHI is public health broadly, so it's not a perfect tool for looking at MCH system capacity, but it has lots of really good ideas, really good questions, food for thought. So we pulled some ideas from there. We also looked at the Public Health Accreditation Board standards and measures, which is of course public health broadly as well, and it's specific to the to governmental health departments and the responsibilities of those. So it really isn't a system assessment, but again, it has lots of really good ideas and questions, so we pulled from there as well. And of course, the health departments in Michigan that are exploring accreditation or have become accredited or somewhere in between have good familiarity with what is in FAB. We also looked at an AMSHIP resource on the 10 MCH essential sources. That one is a little bit dated and a little example-y instead of sort of big picture, but we pulled some ideas from there as well. All of those are resources that you could look at if you want to approach this in a different way, or if you want to kind of see where any of this came from, then those would be the key pieces of information to look at. We also pulled from an assessment of this nature we did for another project a couple years ago. So a earlier version of this tool has been used in this with MCH system partners to kind of explore what their systems look like. So this will be providing you with an Excel spreadsheet that'll guide this assessment, and I'm going to kind of give a tour of that spreadsheet in this next piece. So you'll use the spreadsheet to help lead your consortium through a discussion under each of the domains or subgroups of your consortium if you just should do it in that way. Each tabs can be printed, so the document can be provided as handouts at the meeting or used for note-taking or documentation. We really encourage you to streamline the process by just bringing a laptop and typing your notes right into the Excel file, so you don't have to do that at a later time. And we encourage you to try to include as part of your discussion both notes and examples of things that are going well and things that you can improve that are specifically related to maternal and child health. So even as we were kind of thinking through what the assessment could include, it's hard to kind of bound that around maternal child health and think about what's maternal child health and what is public health sort of broadly outside of maternal child health. Those boundaries are, especially when you're thinking from a life course perspective, blurry. But we want you to try to strike the balance in your conversation as well. One of the things that I've learned from observing or participating in specifically the National Public Health Performance Standards Program assessment is that you only have information based on the knowledge of the people that are in the room. And for a large and complicated system, that can feel uncomfortable, that you don't have enough information to make a judgment. So you might read a question and you think, I don't know of anything that we do in that area, but that doesn't mean that nothing's going on in that area. There could be someone who's not in the room who could tell us X, Y, or Z are going on. So I would say two things in reference to sort of that concern. The first is that it's okay to answer based on what the people in the room know. I think that is generally the case, that the people in the room have a decent sense of what's going on in a particular area. And if no one is able to come up with an example or to think of what's going on, then there might be a gap there. That might be something where you want to do a little bit more system building and system level work. And it's okay to go based on the thoughts of the people in the room. The other point to make is if you're missing a critical sector or a really important partner who isn't able to be a part of the conversation, it's completely fine to check in with them through another mechanism or in another setting to say, we think that the hospital has some really unique workforce development activities around the nursing workforce, but we didn't really know about them. Could you tell us a little? And so that can be included as part of the assessment. So everything doesn't have to be learned through the conversation, and it's completely okay to move forward based on the knowledge of the people in the room, even though I appreciate that that can be an uncomfortable part of this sort of assessment. So the Excel file itself has 12 tabs. So when you receive the spreadsheet, you'll see along the bottom these 12 tabs. The first two are just introduction to the tool and a definitions tab. However, following that, the tabs are organized around each of the domains. And you can kind of see how that looks in the bottom of this particular slide. You click on each of the spreadsheets, what pops up looks something like this. And read a couple of the questions, but I can't skip them. Oh. So this column, the first column will have the sorts of questions that your group will discuss. So this one is, does your community regularly bring together a group of MCH partners to become to better understand MCH needs in your community, with some sub-questions? Does your group include traditional and non-traditional partners? Does your group include community members? What partners are missing? So your discussion will probably identify several things that are going well, and then some areas where you could potentially do a little bit more work. And so we want you to kind of document both of those things, as well as just describing what is going on. So we have this particular group. It includes a lot of partners that are related to health during pregnancy and the infancy period, but we don't necessarily bring in partners on a regular basis around assessment that include all of the other areas of maternal child health. So we have a group, they do really great stuff. We have some gaps in that partnership. We would expect sort of both of those parts of the conversation to happen and to be noted and documented. Our slide. It gives a little bit more information about the way that the spreadsheet is set up. So the first column, I said, contains the discussion questions, and you'll note that part of the some of the cells have some language, and those are examples. So we tried to provide some examples of activities where we thought that the question might be a little bit confusing, might be hard to figure out where to start the discussion, so there's some examples. The questions are intended to be used to generate conversation among the members of your group related to each standard of measure. And the discussion questions are to help your group in thinking about what's being done now, what's going well, and what can be improved. You don't have to answer every question. If you feel like a question isn't relevant for your community, or your group is going to really have a hard time with it, or for some other reason you kind of want to tweak it or change it or delete it, you're more than welcome to do that. This is intended to be a way of exploring essential service for your community so you can make it fit. Again, the second tab on the spreadsheet has some definitions that might be helpful. So as you're having conversation, we suggest that you document your conversation in the body of the spreadsheet. Although, of course, you could just open a Word document and document your conversation there. And again, we'd like you to talk about we would suggest that you talk about the current status, so just describing what you do around bringing partners together to complete assessment or provide data to your community, talk about the things that you do, talk about what's going well with that and opportunities for improvement or gaps. In completing this assessment, one of the things I've observed, again, in using the MPHI SP, this is part of the process that is the most important and meaningful and impactful is the discussion, is kind of diving into these ideas that we almost never really talk about. It's talking about our infrastructure, our capacity, how we do our work, and the systems that we have in place that make the work that we do possible. And so having a conversation about that is both is unique and challenging and really can be very eye-opening. So having these discussion notes is, I think, the most important and meaningful sort of output of this process. However, we do have on the next slide a place where you can give yourself a rating. I think from observing MPHP SP, the rating is the hardest part of the process and doesn't necessarily give you a lot of value for how intense the rating process can become. So if you don't want to use the ratings, you don't have to use the ratings. However, they can be useful for pointing you back to the areas where you have the biggest gaps. So just having sort of that summary, we could do a lot of work in this area, or we're really rocking in this area, can be useful, and that's kind of how I would suggest you think about the rating piece of this. But it's definitely not an exact science in giving yourself a rating in these sort of broad areas. The way that we would suggest that you do this if you decide to give yourself a rating is to kind of think about the ratings in the way that are defined on the slide, and this really comes from the MPHP SP if you want some more ideas about how they think about the ratings, and the link is there on the slide. But you would give yourself no activity if there's literally nothing being done in this area that you're aware of or the folks around the table are aware of. It's minimal activity if you think about the different components of the question and the different aspects of what you're doing, and you think that around that there's something going on, but it's less than a quarter of what you could be doing, then you give yourself minimal. Moderate is 25% to 50% of the activity of what you could be doing optimally. Significant is more than 50%, but less than 75%. And then optimal is if you're doing more than 75% of what you could be in a particular area. So those percentages are really hard to judge when you're, answering questions in a conversation-based tool. So again, don't think of it as like a real precise science. Think of it as if we go back to this tool, we want to be able to find those areas where we have not a lot of activity going on, so we can pull those out quickly. I think that that'll be the most useful way to use the rating piece of this. A suggested process that we'll kind of talk through next as to how to complete this with your partners. Before I jump into that, I'm going to pause and unmute and see if anyone has questions about the sort of setup and structure of the assessment. So, questions so far? Well,
it's Renee from Chippewa. Ladies, for the resource site that you've included, I printed the resource PowerPoint, but it's the PowerPoint, I thought it was today's, but it's March 9th. Is today's supposed to be on there to follow as we follow this?
It is. We're going to check into that right now. Had posted an additional PowerPoint presentation from when we initially did the kickoff webinar.
Oh,
so there's
what is on the resource is it's dated March 9th, and it's not the one that you're showing now to follow.
It's called System Assessment. One that is posted for today on the SharePoint is titled LMCH System Assessment Webinar Slides.
It is there. I'll go ahead. The staff look for it again. Thank you.
Yep, no problem. Thanks for your question. I have such a hard time finding things on SharePoint, I tell you what.
Julie, if you're going to, cover this, but I was just thinking about the system and how people might do this. And do you have, I'm putting you on the spot, and I know discussion can kind of go on and on, but just to kind of give people some logistical timing, how long should they plan for each essential service is different discussion. So,
Yep.
you know, there's a variety of logistical ways they can unfold that. But I'm just trying to encourage people to say, you know, you could just put a part of an agenda and put X amount of minutes for a discussion, and that might be a really great way to facilitate this assessment.
Yeah, absolutely. So I would guess that to complete the number of questions in the different domains varies. So length of time would vary a little bit. I would think that between an hour and an hour and a half to go through one domain would probably be realistic. However, just as you're suggesting, Trudy, you could pull out a couple of the questions or a couple of the pieces from a particular domain and include it on an existing for a meeting and set aside 30 minutes where we're gonna talk about assessment, or 30 minutes where we're going to talk about how we approach health education. I think that that's a totally reasonable way to do it.
Great. Trying to give people ideas that might be short ideas, because some have a short period of time, and the ideas, you know, they might do a whole separate meeting to do this.
Yeah.
So there's a spectrum in between that. So that's good to know that that will work.
Yeah, absolutely. Thank you for that idea. So we have a suggested process that we'll go through, but this is certainly intended to be very very flexible. So if you have another idea in mind, or as Trudy suggested, you know, you could break it up in different ways and approach it differently. That's completely fine. We'd suggest that you begin by looking at each essential service and identifying which specific people you would want to include in a discussion about a particular service. These groups could be a variety of numbers of people to have a rich discussion. It can be difficult to do that with a really huge group without some strict facilitation. So you might think about having a group that's kind of the size of a focus group, maybe around 8 people, 12 people, 6 people, something like that. I want to identify dates for the conversations that you want to have and send out your invitations. And you'd want to identify for each conversation that you're going to have someone who's going to facilitate the conversation, someone who's going to move the group through the questions, ask the follow-up questions, as well as someone who can take notes on the conversation to make sure all of that really rich discussion is well documented. And of course, we suggest that you do that right on a laptop so that you have the notes done by the end of the meeting. One of the things that can be really tricky about this type of assessment is that it can be kind of unfamiliar to people to talk about system sorts of issues. How do we do things across our partners? So for all of the different entities that play a role in educating the community about health, you know, you think very much about the programs that you have and particular things that you deliver as an agency, but thinking about what you deliver as a collection of agencies is sort of a different kind of conversation. And so there usually has to be a bit of a stage set for having that type of conversation. So we have out here and some introductory language that you could use, modify, not use if you have another way that you would want to introduce it, or not use if you are a community that has done the MPHI or is really used to talking about system issues. Just use it if it's helpful to you, or pass over it if you don't need it. You think about set a stage for the group, talking about how you and a group of system partners come together to fulfill each of these responsibilities or deliver these services. The other thing that's important to offer in an introduction to a process like this is that permission that it is okay to not know everything. It's okay to give your best guess. It's okay to put what you know on the table, recognizing that you're not going to know everything that's going on within a community. So that permission to an ambiguous space, I think, is important to groups as you get started on a process like this. It can be important to have that reassurance. As you come together, we suggest that you ask the group the questions that are in that first column of the Excel file, of each tab of the Excel file, and ask some follow-up questions. What are we doing now? What's going well? What can be improved? Or additional probes that come to your mind as you're hearing the conversation unfold. Or you need to prompt some additional conversation or additional thinking. Of course, add questions as you see fit. If you'd like to, if you think it would be helpful to the group, ask the group to give an overall rating based on the conversation. So as the conversation is kind of wrapping up around one particular question or set of questions, you can ask each person in the group to say how they would rate the level of activity for that particular type of service or activity. The way that the MPHI does this is each individual person gets a set of coded strips of paper, so there's like red for no activity and so forth. And everyone puts up or puts on the table their rating, so you can kind of see at a glance everybody's on the same page or everybody's on different pages to try to move the group a little bit toward consensus. When you have a situation where you have lots of different ratings in the room, some people think that there's optimal activity, some people think there's no activity. Usually what I would do is ask somebody who has on each level of that continuum to share why they put forward that the color they put forward or why they rated it at that level. And that additional discussion can kind of bring out nuances in what people are thinking, can bring forward more information that you might want to record. So that can actually a really helpful moment when people really disagree on ratings, so that you can kind of uncover those nuances and that additional information that might not have come up through the conversation. Again, it's okay to disagree. It's okay for people to not be sure. And again, the ratings are really intended to help identify priorities at the end of the day, so it doesn't have to be really precise or an exact science to be useful. Of course, we'd suggest that you close each conversations by asking the group for overarching takeaways about system strengths and opportunities for improvement. That summary from the group's perspective of what they heard that really stood out to them in the conversation can be the main findings from the assessment that you use kind of more broadly to inform the priorities in the next stage of this process. So those are really helpful to record and capture as well, those overarching takeaways from the group about system strengths and opportunities for improvement. After you complete this process, in whatever way you choose to complete it, you'll describe your findings using Table 9 in the tool. And you'll organize your findings by the essential services and indicate if your findings are reflecting an opportunity for improvement or a system strength. As we've talked about with the other assessments, we suggest that you describe each finding as one bullet and keep that description to one sentence, but include enough detail that anyone can kind of understand what you mean. We would anticipate that each service would be associated with multiple opportunities for improvement and multiple system strengths. I'm going to take a look at that table on the next slide. So this is the table captured out of the tool itself. You can see it looks really similar to the tables for the other two assessments. In the first column are listed the essential services, and then in the next two columns you see the opportunities for improvement and the strengths of the system and places where you would add your bullets. On the right side of the slide, you see some examples of what we mean by the one sentence around improvement and one sentence around strength. So a strength might be our MCH system could do more to support policy development at the state and federal level by providing information and stories from our experience. And a strength might be our MCH system supports policy development and implementation at the organizational and local levels, especially around tobacco exposure and breastfeeding. So it's really a broad summary of the conversation around what you thought was going really well in that area and where you thought there could be growth in that area. Of the day, the spreadsheet with your typed notes will serve an optional deliverable along with the tool for the child health system assessment. So if you complete this assessment, we'd like you to share the spreadsheet. Again, it's optional. It's not something you have to complete, or you don't have to complete it fully. You can do parts of it if that makes more sense for your community right now. So we're going to take you off pause or mute and for some group sharing. Have any of you on the line participated in a community system assessment before?
Hi, this is Ann. Can you hear?
And Ann, yay! Thank you for speaking up.
So this is Lisa, and I'm sorry I'm at the conference. It's very noisy, and I just slipped out to the side. But yes, community assessment. This is our second time I've participated. And just right now, United Way rolled out our. So I've been gone. They came out with a community needs gap assessment and all that I'll be sharing with you, so you could possibly share it to the web for other people to use. It was kind of a 6-week project, quick turnaround. All the stakeholders kind of gave what they had for data, and they did a quick pulled together think tanks, and then the report came out, I think, last night, and we'll be making some chips or some subgroups based on the findings. So I haven't seen it yet. Very excited, and I'll share it. Thank you, Ann.
Thank you. And
So this is Ann Barnett from Barry Eaton. I would say it might have been like 8 years ago. I don't know. This did a version of the state. I remember the long name of it, but it was the thing where you rated different things. And so I rated that, and I would just agree with you that people really get feisty, surprisingly, about what rating they pick. But I also feel like once people got used to it and they kind of got exhausted, they just sort of went with the flow at the end of it. And I just, the other time that I participated was we had I took some training. So during the MAP training, they do like a pretend version of this. And so I did it then as well. But I never used it in Barry or Eaton County. So I think it'll be real interesting to see how it works here.
do you think you'll move forward with using part of it or all of it?
I think we definitely want to do it. We just need to figure out logistics, and timing might be a challenge, but I think, you know, we had done the community health status assessment last year, so we haven't been working on that, so I think we're ready to go on this one.
Thanks. We're really excited to hear about what your experience looks like with this. It's a really tricky type assessment activity, but so important to get down to that level of talking about system capacity.
Lisa Hahn in Oakland.
Hi.
Hi, and I've participated in a community health assessment, and the thing I do agree, you know, in the beginning people were really concerned, and then it kind of, everybody gets used to the system and able to really pinpoint a little bit, I think, more accurately.
Yeah.
Sometimes they needed to, I rein people in too, because I think people want to get more specific, and you have to keep on task with what you need to accomplish for that rating or for that particular measurement that you're trying to gauge with. Makes sense?
Totally. I think that's a really good observation to share with the group too, of that need for the facilitator to be ready to say, that's a really interesting idea, and bring it back to the sort of broader conversation.
And I think it helped with that. They had like a, let's put in a hold board, or I remember they had a cute little name they called it, but when someone would kind of go off task a little bit, they had this board that they'd write that down. The person that was facilitating would be really good about, you know, acknowledging it. That's really important. Let's put it over here. We're not going to discuss it right now, but we're going to make sure we come back to that. That allowed people to feel like at least they were heard and
Absolutely.
forget. Sometimes you don't want to forget what you're thinking about, even though it might not be related. So
Yes.
it's a helpful too.
Thank thank you for that. That parking lot idea, I think, is really a really good one, a nice facilitation tool to use to make sure people, as you said, know that they've been heard and that that idea won't be forgotten, but to allow the group to move on.
Right. You remembered what it was called, a parking lot.
Thank folks that have had experience completing a system assessment before. I think it's great. Those are some really good ideas and tips shared by your colleagues. So thank you so much for that. So we recognize that there's variability and sort of familiarity with a process like this. We know this kind of process is tricky, and it can be kind of hard to think about how to get it started and you know, what plan for. So if you are feeling like we want to try to do this, we want to try to do part of it, but we're not exactly sure, we're not totally comfortable, just reach out to us for support. We're more than happy to set a one-on-one webinar to go through the process in more detail, or to support you in another way that would be helpful. So just let us know if there's more support we can provide to help this move forward for you. I'm going to pause and ask if there are any questions about this assessment that we can answer before we talk about sort of our more overarching pieces. Do you have any questions before we move forward about the assessment?
This is Arna. Do you have any stories or experiences with folks who used a survey methodology? With like they sent a survey beforehand or anything like that? What are your thoughts on it, I guess?
I think if I know anyone who has done that for this. I know that people have definitely sent out the question or the assessment beforehand, and I think that that's a really good idea. So that people can take a look at it and kind of gather their thoughts or even gather information from colleagues before they come to the room. I think that's a good idea. I'm trying to think when has done a survey. So you're thinking of more of a structured response survey where it's the questions and then those response options and kind of gauging where people are before the conversation?
Yeah, I mean, you know, sometimes it's easier for people to react to something than it is for them to, I know, I'm curious because I recall it, you know, it's kind of I mean, you could set it up as a survey easily, but I do agree that you would run into the issue of people really not understanding what they were being asked, you know, if you have time to discuss it.
I think that from what I've observed, I think that the discussion is the most important part of this sort of assessment activity, that, you know, exploration of who does what and what this means for different organizations, and that sort of nuanced gap finding that happens in this sort of assessment. I think that that's the most valuable piece of it. I think that what I like about the idea of doing a survey before you have the discussion is that it would get folks the questions and working through the questions in sort of a structured way, like, and it would also give the facilitator, I think, a sense of what people are coming into the room thinking. I think that probably the answers after discussion would be very different than the answers before the discussion.
I think the answer could be very different, and the discussion is so important because you don't really know what your partners are going to bring to the table, and so you know, could have a pretty conversation based on what one person says, and then another person might react, and you get a whole different feel for your community than, you know, just gathering things by survey. So, you know, I mean, both tools can be helpful, but I think the system particularly, my sense is that people gather a lot of numbers, data, and metrics, and each have used, you know, good qualitative, quantitative data. But we don't necessarily do this discussion systems piece very often. Sometimes sometimes this is a collected piece of assessment. And so the richness of the discussion, although I've ever participated in this, I am just imagining it from a theoretical perspective, just would be so rich.
Yeah. Yep. It's pretty powerful to hear people talk about these from their different vantage points within a system. It's really interesting. I think another question. Hi.
This is Gina from Ingham County, and I was trying to interject that we have done a SurveyMonkey actually in advance, and what basically kind of some of the things you said, it gave us an opportunity to get feedback from those partners, et cetera, and kind of figure out where we wanted to go with our data. So we had about 9 topics or things that we asked them to take a look at and give us some feedback as what they felt was the most important in their community and with the work that they were doing, but also how that aligns with the work that we're doing. So yes, we did do a survey to start out this process.
Regina, that's awesome. Thank you for sharing that. Is that would you be willing to share the tool that you use?
Sure.
Awesome. Yeah, thank you so much for jumping in and sharing that.
You're welcome.
Something too, Regina, is that you did in advance and kind of got an idea of what topic was most important. And so if you're struggling that you can't do this whole assessment and you're trying to decide which one or two of these components you're going to do, a survey in advance might help you to pick one or pick 2 that are really important to people, and then have a discussion around those 1 or 2 without just picking it out of the blue because that one sounded good. So that could be really a great tandem to do this assessment. So thank you for that, Regina.
Yeah.
Absolutely. You're welcome.
Are there
question, but this is Lenawee County, and so after our first meeting, because the groups not have the time to commit to having many person-to-person meetings, we did also send out the SurveyMonkey to let people think about the conversations that we had and the things we identified, and then we gathered the information to kind of coalesce down to 1 or 2 items from our SurveyMonkey, and that seemed to work well.
So when you were doing priority setting? Yes. Cool. I think that can be a helpful way to do priority setting when you can't get together. Other questions or observations or thoughts or resources to provide? Okay, a couple of additional talk about today. So after a long and very diligently followed process, everyone should now have received their feedback form for steps 1 through 3, as well as their data workbooks for the status assessment. As a reminder, you should have 3 workbooks there. You should have a workbook that has state data, a workbook with data specific to the county you're involved in your assessment or your county, and then a workbook with some supplemental data measures. So as you may have picked up after we did our initial webinar and put together the initial workbooks, we received great additional resources and additional data that we wanted to make sure that you had on hand. So it didn't all come out in one streamlined package as we hoped, but hopefully you all have those workbooks available to you, as well as the additional resources that are posted on SharePoint. If you don't have your feedback form or you haven't received your data workbooks, we've had some struggles with email blocking and the size of the files and all of that. So just let us know if you haven't received something that you should have received, and we will troubleshoot to make sure it comes your way. As far as we know, everything has gone out and is in your email or somewhere in email land. But let us know if you don't have it.
Also, this is true. I would like to apologize because we had to send out. We couldn't. It was hard to tell whose email system was blocked due to size or blocked due to something else. And so we were trying to condense files so that we send them, like one file in 3 different emails. So I just want to say I apologize for filling up your email box, but I hope that you appreciated all the wonderful data that was there. So thanks for your patience with us as we were trying to kind of problem solve that.
Any questions or needs around the data at this point? If you need any help with any step of the needs assessment process, we're available for technical assistance, and we look forward to hearing from you. And we'll actually likely be reaching out to you to ask if you need anything from us within the next couple of weeks. We know making that first contact can be tricky, so we'll reach out to you and ask if there's anything that we can do to support you, and are very happy to meet whatever needs you have as you go through this process. You'll continue to work through your 3 assessments, and your completed steps 4 and 5 will be submitted to us by June 23rd. If you choose not to complete the 3rd assessment, just note that in the body of the tool when you submit it, just so we know that we know what you chose to do, and we'll be able to respond appropriately. But again, if you need more time, if June 23rd is going to come up too quickly for you, let us know. And you'll email your submissions to Lauren. And our next webinar to talk about the next pieces of the process will be on June 14th from 2 to 4. Are there any last questions or comments before we wrap up today?
I do, particularly with all the data that was sent, sometimes, particularly if you don't have an epidemiologist on your staff and you don't know how to interpret that data, please feel free to reach out. We can help you figure out how to do some data analysis if you're struggling. So no need to struggle. There's a lot of people that are willing to help.
Okay, thank you so much for being on the line today, and we look forward to hearing from you and learning from your assessment processes. Really great afternoon.
Thank you.